and Dr. Sarita Rao, Senior Intervention Cardiologist, Director Cath Lab, Apollo Hospital, Indore. Thank you all so much, doctors, for joining us today. I would like to start with you first, Dr. Rao. You know, when it comes to women, we're discussing women. If one suffers from hypertension, one is more likely to experience mood swings, anxiety, and depression as compared to people with normal blood pressure. So specifically, if I ask you for women, can hypertension cause anxiety?
So that's a very interesting question. You know, hypertension and anxiety, they both go hand in hand. So if you have high blood pressure, there are chances that you will be worried about your future, about your health, and that can lead to anxiety levels being increased. And when you're anxious about your health, also hypertension also produces symptoms like headache, or sometimes you have symptoms like a blurring of vision, or you have a pressure shoot and you get very anxious. So yes, people with hypertension tend to have higher levels of anxiety, and when they get anxious and they have higher levels of anxiety, it also produces an increase in the heart rate, a further constriction of the blood vessels, and that would lead to a further shoot of your blood pressure. Now, having said that, if you are an anxious gentleman or a gentlewoman, so if you are an anxious person, there are chances that you might develop hypertension, because anxiety per se produces a rise in the blood pressure. In most of the people, it's temporary. But if you have chronically increased levels of anxiety, this can have effects on your target organs like your heart, your kidneys, your brain, and subsequently you might develop a chronic hypertension. So yes, anxiety and blood pressure, they do go hand in hand.
They go hand in hand. I think that's why it's important that one takes care of anxiety so that hypertension can also be controlled. Dr. Sharma, hormonal cycles can affect women's cardiovascular health. Estrogen is protective of the heart, as estrogen relaxes the arteries and promotes good cholesterol. So will estrogen replacement therapy help reduce the risk for heart disease?
So because of the fact that we think that estrogen is helpful, so it was once thought that it could probably protect heart diseases. But as a matter of fact, females who took HRT for a long time, they were more prone for having heart diseases, strokes, gallbladder diseases, breast cancers. So the risk actually outweighs the benefit of this therapy. That is why hormone replacement therapy is actually not recommended nowadays for prevention of coronary artery disease in women.
Okay, Dr. Rao, if we talk about physical exercise, we know that is really important for everybody and it keeps us fit and fine. So can exercises relieve stress, since we were talking about anxiety? So what are your thoughts on that, and which are the best and safe exercises for women with hypertension and heart disease?
So exercise actually is a very wonderful thing. You know, it's one of the best strategies that you could have for combating heart disease, for combating your stress levels, because when you exercise, you improve the quality of your life, both mentally and physically. So what happens when you exercise actually? It increases the blood flow. It also increases the capacity of your body to provide oxygen. At the same time, it strengthens your immunity. It improves your physical appearance. It gives you a better sense of well-being. At the same time, it lowers your blood pressure levels. It gives your confidence a boost. And when you exercise, you know, there are these feel-good neurotransmitters which are relieved and which give you the high which runners experience. So exercising, all in all, is a very good thing that you must do. Now, the American Heart Association, they have recommended that every person must get at least 150 minutes of exercise in a week. We normally divide it into 30-day intervals for 5 days in a week, but you can schedule it as you want. But the most important exercises that we think of talking about, which, you know, do not require any equipment, you can do it anywhere, would be like brisk walking, like running, jogging, cycling, swimming, or it could be just as simple as gardening, which you enjoy, or dancing, which you enjoy. So the important thing about exercise is choose something which you enjoy.
Yeah.
Have an exercise buddy who motivates you. and incorporate it into your daily schedule.
Yes, I think that's a very important thing what you said, that one should enjoy whichever form of exercise they do, not just do it like a routine, but enjoy it. Dr. Preeti, we were talking about how women are more prone to anxiety disorders and they do tend to take more stress because they do have a lot on themselves. So why are women more prone to stress? That's a very basic question, but we see that all around us.
So yes, nowadays, apart from the home front, now we are working, we are handling some stressful situations. Some of us are heading few offices. So now women are not confined to only home. Now they are taking care of other things also. They are career oriented. But you cannot actually left behind any part of yours. Like you cannot left behind your kids. You cannot left behind your home. So you have to manage all these things. So one person managing all these things, taking care of all these things, and want to be perfect in everything. So this kind of stress actually leads you more prone for anxieties, and this perfection in everything, because you want to take everything along. So this actually creates a kind of stress on women, which nowadays are experiencing because of career as well as managing them.
So yeah, I think it's important that one, has to balance it, of course. But, just a further question which I would like to ask you, we've spoken about why women tend to have more stress, why do they have more anxiety? But, how should they manage it? We have spoken about how exercising can help them. It is good for the physical as well as mental well-being. But how do you think women can cope with this? Because that will help a lot of our viewers understand how to really manage anxiety and stress.
So yes, very good question. Whenever you are managing home as well as you are managing your offices, so it is very important to just take care of yourself. Take out some time for yourself. And how do you do it? As Dr. Sarita mentioned, that you can just have a morning schedule of brisk or going for cycling, yoga, meditation. So these all things, they help you in relieving stress. And apart from this, your favorite music, like listening music, dancing is a great stress buster, and you can indulge yourself in any kind of art or anything you enjoy. Or watching a movie can sometimes help you in releasing these kind of stress. Okay. And now what we have realized in these recent times is, after COVID, that very important is to have a good social support group. Your friend, they from offering a supportive ear to lending a helping hand whenever you need them. And it has been seen that people who have good social support, they are less stressed, they are more happier and healthier.
Okay, I think those are some great points. Moving on, Dr. Rao, regular health monitoring is key to keeping away from major chronic disorders. But women, again, are way too busy, looking after others, and they forget about their own health. At what age do you suggest that women should start doing regular health checkups, screenings? And what screenings do you suggest, and what screenings are a must?
So I'll say, no age is too early.
Okay.
So generally, we recommend that everybody who's above the age of 45, they need to be screened for cholesterol. But sometimes we say that you actually need to start after the age of 30. You should get yourself screened. And we have, customized health checks for all of these screenings. So women, they need to go in for getting their cholesterol checked, their blood pressure checked, their blood sugars checked. They also need to get a pap smear done. Also, if you have a family history of heart disease, you would require to get a treadmill test done and an echocardiography done. So it's important that you get your, you know your numbers. You know what's your blood pressure, you know what's your cholesterol level, you know what are your sugar levels. It's important that you also look at the side of being a woman. You also get a mammogram test and you also get a pap smear test done. Although I'm a cardiologist, I would say that those are also equally important things, because even though heart disease is the #1 killer in women also, it's closely followed by cancers also. So I think it's very important that you go in for one of these healthy heart checks or in executive health checkups, which we as hospitals like mine at Apollo, we have these subsidized health check for women, which they should come in annually. Once in a year, give some time to your health, your body, because you as a woman are extremely important for the well-being of your family.
Absolutely. I think that is a very, very important point which you put out there. Dr. Rao, I would like to ask, of course, we know screening, we've understood about anxiety, what we can do to deal with it. But again, eating habits is something which a lot of women tend to overlook. Either it's because they want to lose weight and there are so many fad diets around, or, they again don't have time. They're trying to make or cook things for their family, what their children like, what their parents like. So how important is a healthy diet for women?
So I think a healthy diet is one of the basic things that we are looking at, and I think it's extremely important for you because so for a healthy diet, I don't recommend any major diets. What I simply say to all my patients is that make sure that you get your daily dose of green vegetables.
Okay.
Make sure that you get daily dose of fruits. So fresh fruits, green leafy vegetables, and natural foods.
Yeah.
Stay away from fast foods, stay away from processed foods, because these are extremely high in calories. They're extremely rich in their sugar content and will predispose you to obesity, predispose you to diabetes. So our Indian system of eating has always been very good,
Yes.
So the basic fact that in our Indian culture, it's promoted that you have proper cooked food, that you have green vegetables, that you have fresh fruits, you have a certain amount of milk. So all of these natural foods, the Indian foods which we normally have, is very good. Stay away from processed fast food like burgers, pizzas, and all of these things. They're not good for your body, and in the long term can be disastrous. If you look at children today, childhood obesity is on the rise.
Absolutely.
It's not only because children today, they don't play. It's also because all the children today eat are pizzas, pastas, burgers, French fries.
So wrong eating habits. I think that those are some very important points which we've discussed, and it's time women really take on their health seriously. So on this note, we're going to be taking a really short break. This conversation will continue.
They say the zero is nothing unless it connects.
The maximum number of hours and the resource, personal level I have spent was when I was talking with Congress, almost 5 months.
What happened with the Congress? Why was there a breakdown?
For my side I can tell you, but I had a bad experience working with Congress in UP.
Yes.
And hence, many things which otherwise I would have said yes, I was more skeptical.
One thing that's clear, our world is changing forever.
NDTV, Rail News by Rail Journalists.
सच दिखाते हैं ताकि दुनिया के बाजार में आजादी सस्ती न बिक जाए। कुर्सी पे बैठने वालों को जमीन की अहमियत याद रहे। सच दिखाते हैं हम ताकि पैसे की चमक से कभी हुनर ना पड़े फीका, खुदगर्जी खोखला न बना दे सोचने का तरीका। सच दिखाते हैं हम ताकि अच्छे विचार और आदर्श बस किताबी बातें ना रह जाएं।
चुनौतियां काफी ज्यादा हैं, बड़ी चुनौतियां हैं।
एक बेहतर कल चाहते हैं हम, इसलिए सच दिखाते हैं हम। NDTV इंडिया, जुबान पे सच, दिल में इंडिया।
लाल टोपी वाले यूपी के लिए रेड अलर्ट है, रेड अलर्ट।
इस बार किसानों ने दरवाजे बंद कर दिए भारतीय जनता पार्टी के।
The responsibility for Uttar Pradesh is mine and I'm dealing with it.
मेरा कोई USP नहीं है, अपनी धुन में रहता हूँ मैं भी तेरे जैसे।
कौन बनेगा मुख्यमंत्री सीधा पंजाब बताएगा।
Do you feel that this is an existential battle for you?
I have nothing to lose.
I had a bad experience working with Congress in UP.
Yes.
And hence I was more skeptical.
अखिलेश यादव को चुनौती दे रहे हैं कि आपके खिलाफ लड़े।
चुनौती मुझे देने की आवश्यकता नहीं है, वह दाखिल करें तब भी कमल खिलेगा। मैंने
ये कैंडिडेट इस पार्टी से उसमें चला गया, ये कैंडिडेट इस पार्टी से इसमें चला गया, ये इसमें से, ये चल क्या रहा है गोवा में?
validation of what's been very tough months of journalism during a pandemic.
Third wave is inevitable and it's basically based on human behavior.
The interval between doses for the mRNA should be 3 weeks for the Pfizer and 4 weeks for the Moderna.
Some unknown person donated blood and saved my family member's life.
Welcome back. We're talking about how women need to prioritize their health. Dr. Sharma, again, sleep is of utmost importance to health. Can irregular sleep increase the fluctuations in glucose levels?
Yes, so sleep actually is very important, and 8 hours sleep for an adult, and for a child it is approximately 10 hours of sleep, which is a must. And if we have irregular sleeping habits, as we see that nowadays because of working late at night, our IT people are working late in offices and they have this fragmented sleep, which actually creates a kind of sympathetic drive and creates a kind of impaired blood glucose state, which actually leads to development of risk factors like high blood pressure, diabetes at early ages. Obesity is very common because of these irregular habits of sleep and diet. So this is very important to take care of this, and just take out time, have a schedule for your at least 6 to 8 hours sleep, which is very important, I would say, for prevention of diseases.
Okay, sleep is of course key. Dr. Rao, again, there is this misconception that a heart attack is only a man's disease. Is that true? And are symptoms of heart disease the same in men and women? And how can we prevent heart disease in women?
So yes, there is a misconception that, it was earlier thought that heart attacks commonly occur only in men, but that is not so. The number one killer of women also is heart disease. Now, pre-menopause, women are to a certain extent protected from heart disease, but then after menopause, the incidence of heart disease in men and women is almost the same. Now, for a woman, the symptoms are very different because a woman does not complain of the typical crushing chest pain which a man complains of when he has a heart attack. She will complain of non-specific things like, a feeling of discomfort in the back or in the shoulders or in the jaw. She'll complain of an uneasiness, a lightheadedness. Sometimes she may just complain of extreme fatigue or lethargy. So her symptoms are not so typical. So it's important that we have a very high degree of suspicion when you talk about a heart attack in a woman, and her symptoms are to be taken very seriously. Now, having said that, how do you prevent a heart attack in a woman? The methods are the same. There are two things. One is lifestyle changes. So lifestyle changes, I mean that exercise daily, eat healthy food, that is fresh fruits, green leafy vegetables, cut down on sugars. And third is take time to, de-stress yourself, because women today are under a lot of stress. So take time for yourself, de-stress yourself. Okay. And if by any chance you smoke or you drink, try to avoid those things or quit them altogether if you can. Mm-hmm. The other thing is, other than lifestyle, we talk about know your numbers. Yeah. Know your numbers means know what is your blood pressure. If it's high, get it controlled. Know what is your sugar level. If that is high, if you have diabetes, please take measures to control it. And third is also look at what are your cholesterol levels. Please get a lipid profile test done, very easily available test. And if your cholesterol levels are high, take measures to cut down on it. So I would say these very simple measures which we can take can grossly reduce the incidence and the prevalence of heart attacks in our women population.
Okay, I think that's really well explained. Thank you. Moving on, Dr. Sharma, women hardly get time for themselves. We've been discussing that through the show. And most women are going out for work. They handle office and home simultaneously. Is it obvious that they are under constant pressure? And what stress-busting activities can you suggest to these women?
So we just discussed that the stress-busting activities which one can follow. You can start with a morning regime of exercises, yoga, or simple meditation, or you can indulge in some creative art. You can indulge in, you can go hiking, you can go for strength-building exercises, and dancing for that Zumba. It's a very good stress buster. You get to meet your friends. You do good exercises. You can listen to music, you can watch a movie, and you can take breaks. Important is taking breaks from your routine schedule. You can take a small coffee break between your work schedule, or you can take a break for 2 or 3 days. Just go for holidays, and then once you come back, you are rejuvenated, you are mentally happy, and you do your duties maybe much more happily. So the important thing is to be happier at work, wherever you are working. So the important thing is to cut down stress and just do whatever you like. Don't stress yourself and just take care of your health, which is very important, I would say.
I think taking care of one's health is really important, especially for women, because they take care of the family. Dr. Rao, again, menopause is something which one really doesn't talk about. Menstruation still people talk about, but menopause is again put aside. Tell us something, does menopause actually reduce immunity of a woman?
I couldn't hear the ending portion of your question.
No,
you said
does menopause reduce the immunity of a woman? You know, when she's reaching menopause, does that impact her health or her immunity?
So let me talk to you. Menopause is a very important time for a woman, in the same way that a menarche is, right? So menopause is a time when our body, undergoes a lot of changes. So you tend to get hot flushes, your stress levels tend to increase, your irritability tends to increase, the way you respond to a situation, it also increases. At the same time, because I'm a cardiologist, I'd always talk about heart disease. Your risk of having a heart disease also increases. And that is the time that the bones of a woman also, they start getting weaker. So yes, menopause is a time that you need to sit back, look at yourself, and start taking out more time to look after your health. Because yes, that is the time that our body undergoes a major physiological change. It's not pathological, it's physiological. And that is the time that you need to start looking after your body more. That's important.
Yes, in fact, I think that's really, really important. Dr. Sharma, what are your thoughts on that? Of course, Dr. Rao has explained us, why it's important. Any thoughts on how women can actually prevent or take care of themselves even more when they're reaching menopause?
So, as Dr. Sarita discussed, so important thing is to note down that there are major changes happening in your body. And now your estrogen, protective estrogen is no more there. And now your risk of having a heart disease is actually as of a man of your age. So now you need to be very careful for your risk factors like management of diabetes, high blood pressure, and obesity. So now your BMI is less, so you cannot eat that much that when you were young you were eating. So you have to take care about all these things. Eating right, this is very important, and regular screening of cancers after certain age. That is very important because these regular screenings, they help in early detection of any risk factor, and they can diagnose the disease in early stage, so that you can treat them effectively, which you cannot if you ignore your symptoms, and when you are diagnosed with something in a later stages, then the treatment options are limited.
Okay.
So important thing is to take care of your health, go for routine health screenings, and check your blood pressure, sugar, and weight. And this is very important at this stage.
Yes, I think those are very, very important tips for all the women out, who are listening. Dr. Rao, just another thing, you did say menopause, causes irritability. Women go through mood swings. So, any tips on how women can actually manage their mood swings better? Because that obviously affects the whole house.
So, like I say for women all the time, that it's very important that you learn to prioritize yourself. Remember that you are important, and taking out time for yourself is not a crime. Because if you are not healthy, if you are not fit, and you are not well, then you are not going to be able to give your 100% either to your family or to the community or to the workplace at which you work.
Yes.
So it's important that you take out me time.
Yes.
Time for yourself. Second, it's important that you learn to say no. The world expects us to be superwomen, and to a certain extent we are. But we cannot always do everything all the time. It's okay to say no.
Yes.
The third thing is learn to relegate responsibility to other people, because you cannot do everything yourself.
Yeah.
It's important to relax. It's important to take time, enjoy with your family, with your friends if you want to. It's important to pick up a hobby which you enjoy. It could be as simple as dancing to singing to walking or to running. But take out time for yourself to de-stress.
I think some really, really important points out there, what you even said about me time, prioritizing one's own health, especially for women. Thank you all so much, Dr. Sharma and Dr. Rao, for joining us today. Thanks so much for watching. News will continue on the other side.